फ्रेंड्स, मैं डॉक्टर शेफाली अग्रवाल आज अपने इस वीडियो में आपको टॉन्सिलाइटिस और उससे जुड़ी कुछ होम्योपैथिक दवाइयों के बारे में बताऊंगी। तो व्हाट आर टॉन्सिल्स? The tonsils are the two pads of tissues that are present at the back of your mouth or the top of your throat. These tonsils are the part of our immune system, which means they have the WBC or the white blood cells and can also make the antibodies to fight against any infections. These tonsils are the first line of defense, which can act as a filter and trap the pathogens, bacteria and viruses that could otherwise enter into your respiratory tract. But sometimes, due to overcrowding of these bacteria, viruses, the tonsils become inflamed and causes the symptoms of tonsillitis. Now, what are the signs and symptoms of tonsillitis? The signs and symptoms include the red and the inflamed tonsils, difficulty swallowing, sore throat, headache, fever, a bad smell from the mouth which is called halitosis, a yellow or a white coating can be seen on the tonsils, the pain may be severe which can extend to the ears, and sometimes vomiting is seen in the children. Now these tonsillitis is mostly caused by the virus. And the most common virus is the virus that causes the common cold and the flu. But the bacterial tonsillitis is also very common and is caused by the group A streptococci bacteria. And we also call as a streptococcal throat. The tonsillitis is also most common among the children because the children are in more contact with other children who may be carrying these viruses. Now, how we can prevent the cases of tonsillitis? It can be prevented by maintaining a good hygiene. Means wash your hands frequently, especially after touching anything. Second, do not share your things with others. Your food, your utensils, your personal care products, your toothbrush. And try to stay away from the people who are suspected of carrying these viruses. Now, the tonsillitis, in cases of tonsillitis, what we can do at home to ease our pain. To encourage your child to take plenty of rest. Second, salt water gargle should be done 2 or 3 times a day. Take the food or beverages that suits your throat, such as hot soups or the tea. Fourth, try to keep your throat moist by taking some lozenges such as Honeatus or Coughlin. Now, what are the homeopathic medicines we give in these cases of tonsillitis? The medicines that come on the basis of symptoms is the Hipersulf 200. In Hipersulf, a sensation of plug or a splinter is felt in the throat. ऐसा लगेगा जैसे कि कुछ काट रहा है. There is a difficulty in swallowing. Hipersulf 200 is given in such cases of tonsillitis. The second medicine that comes is the Marksol. Marksol is also given in 200 potency. Here a yellow-white coating can be seen on the tonsils or on the tongue. The pain is so severe that it extends to the ear. Excessive bad smell is present from the mouth. The third medicine that comes is the Belladonna. Belladonna is also given in 200 potency and it is generally given in those cases where the throat pain is relieved by taking warm liquids and is aggravated by taking cold. Inflammation of the throat is present. The throat is red and swollen. Now, the other medicines that are given in the cases of tonsillitis is lachesis. Lachesis 200 is given when the difficulty in swallowing and the pain is aggravated by drinking warm liquids. So here the contradiction is present, that is, pain is aggravated by drinking warm liquids. Give lachesis 200, 1 dose. The second medicine that also has a difficulty in swallowing is the phytolacca. Phytolacca berry Q is given in the cases of sore throat. This is the tincture and it should be given in water. 15 drops in water should be given 2 to 3 times a day. Now, the sorinum is given as an intercurrent remedy to boost the immunity in the cases who has the susceptible to catch cold, or the children who catches the cold easily, and the cases of tonsillitis. Sorinum 1 mg is given in these cases. The Berita 200 is another medicine which is generally given in those kids who are prone to catch cold. The medicine that comes in the bacterial tonsillitis, where a bad breath is present from the mouth and is most common in the school-going children, is the streptococcinum. Streptococcinum is given as a 1 mg potency.